refrain or desist from unnecessary points of order or interjections. We will go straight on, honorable members, to the presentation which you had received already from Ms. Machalamba and from the department. I will now invite the Minister to please give his opening remarks and to introduce the people who will be doing the presentation to us. Thank you, Honorable Minister.
Thank you, Honorable Chair. I hope that my audio is audible. If there's a problem, I might switch off the camera. Maybe I should do that. At least the honorable members have seen that I'm not a ghost, that I'm really here in person. Just to save the bandwidth, I'll switch off the video for a short while. Thank you very much, Honorable Chairperson, and greetings to all the honorable members. And thank you for giving us this opportunity to present on the health regulations which have been published for public comment relating to management of the notifiable medical conditions. We appreciate this opportunity provided to us by the honorable members on a very demanding day, the day before Good Friday. I know that most people are traveling to be with family. Maybe the good thing is that we are doing this on a virtual platform. So I hope honorable members are already at their destinations where they will spend the long weekend. Just from my side, Honorable Chair, just a brief background to where how we arrived at where we are. Now, as honorable members will know very well that what is prompting the amendment of the regulations, the health regulations relating to notifiable medical conditions. It's a well-known fact that this is because since the breakout of COVID in March 2020, government looked at ways in which it could provide guidance to the country, to the public, in terms of public health measures, in terms of what was known as to the contributing or the factors which, the risk factors, let me say, in terms of the spread of COVID-19 and its severity and affecting the population. And on the basis of that, government adopted the use of the Disaster Management Act. And in terms of this act, over the last 2 years, various regulations have been passed and directives also gazetted by the Minister of COGTA as the lead minister in terms of the Disaster Management Act, but also in terms of that, those regulations, various ministers, including the Minister of Health, could then issue sub-regulations and what is called the directives in terms of the Disaster Management Act. But as the severity of the COVID has been reducing, and as many people have been vaccinated, and also believed that also natural immunity in terms of the fact that many people have had the COVID infection over time, over the very many waves up to the 4th wave, which we just went through from November up to very recently in February, March. As the severity has been reducing, the government has found it necessary to then exit the use of the Disaster Management Act. And in that process, look at, ask various departments to look at other regulations within those departments, which can still assist in terms of providing a public health measure to make sure that we don't lose the gains which we have had as a result of public health measures which have been taken to reduce the risk and severity of the impact of the COVID-19 pandemic. Now, in that process, the Department of Health was not logically identified as the department which must lead in this process, because in the large measure, this is a medical condition. The COVID-19 is a medical condition. So in doing so, we went back to the National Health Act and its regulations, as we will see from the presentation. We looked at the regulations which were promulgated in 2017 for control of notifiable medical conditions, the regulations on surveillance and control of notifiable medical conditions. And we used that as a base through which then we could provide alternative public health measures which could help us to manage the remaining threat of the COVID-19, as we know that even though we are now at what the scientists describe in terms of the curve, as we always talked about flattening the curve, where we are with the curve now after the fourth wave is we're at the bottom end or the trough of the curve, with lower infections, lower positivity rate, lower hospital admissions, and lower deaths. But what we also are conscious of from our own experience, and also the experience of looking at what is happening elsewhere in the world, from our own experience, we know that we have gone through this over the last 2 years, that we go on the trough, on the bottom end where this situation exists, where few infections, very low numbers in hospital, but then something else happens, various issues, including the movement of people, the interference of new variants, and then the next thing you get into a steep rise in infections again. That's what we have gone through. So at this stage, we have got no basis to believe that that is not going to happen anymore. And notwithstanding.
Excuse me, Minister, could you try to keep that video on? We're live on all platforms this morning. I'm sorry for this. Thank you.
Well, okay, I hope the bandwidth will survive. So thank you very much for that advice, Chairperson. So the essential issue here is that even though we are at the bottom end of the curve in terms of where we haven't just exited the fourth wave, we have been here before. First wave from March up to around September 2020, we went on to the bottom around October. But came November, we had some rise in infections, and by December we're in the second wave. The same thing happened. We exited the second wave right on the bottom. Then around in July of 2020, we again went on to the Delta variant hit us very hard. The second wave was the Beta variant. In July of 2021. Were hit by the Delta variant. It went down, and we're able to even go to the local elections with very low infections. A few weeks after the local elections, after we had the elections on the 1st of November, still on a very low rate of infections. As we went into middle of November and late into November, the Omicron variant was confirmed as the reason why we're starting to have a rise in infections. So we've been here before. So currently, the fourth wave of Omicron has just gone through. We're at the trough at the bottom end, but we know that this is an experience we have gone through. So until such time that it can now be confirmed that either maybe the virus has burned out or the immunity in the society is such that there is no further risk, we believe that we still have to have public health measures. But also we can see what is happening in various countries, including countries which have had even more higher rate of vaccination at 70, 80%, some even at 90%, but experiencing new rises in infections. So that is why government has then come to the position that we cannot continue using the Disaster Management Act. We need departments to then come with other provisions which we can use. And from the health side, we have looked at the notifiable medical conditions regulations which were already promulgated in 2017. I emphasize this point, honorable members, because in the public out there, there's maybe a misunderstanding, and I suspect even from the feedback we get from some of the honorable members, there is a misconception that these are new, completely new regulations. As you will see from the presentation, there has been some measured amendments in some cases, but in many cases, it's basically an amendment on regulations which actually have been in existence for the last 5 years, from 2017. So that's what we will be presenting, and we just want to assure the honorable members and the public that there is no desire from myself as a minister and the team from health to want to continue to control people's lives unnecessarily. This is purely in terms of making sure that we do have instrument through which this threat, which still exists, we are quite conscious of the fact that if we totally just drop everything about containment of the pandemic, we have seen what has happened in our case, but also what is happening even in other parts of the world. So our advice is that it will not be a good direction to simply just drop everything. So as you will see from the presentation, what we have settled on using the amendment to the existing regulations is really to keep the barest minimum of what we believe is necessary to assist us in terms of currently to keep the infections rate low, to keep this lower ebb of the graph very low as it is, flattened as it is, and delay any rise in new infections so that we don't burden our health facilities and our health workers who are already very stretched and really have had quite a lot of stress as a result of the previous waves. So, and the idea also, just to emphasize that the suspicion that in terms of these new regulations, this can go on forever and ever. We want to dispel that myth as well, that this is to manage, these regulations can be amended as the situation changes. So the fear that in terms of this regulation, some of the measures looks like can go on forever. We want to dispel that myth also, that is definitely not the case. So with that, Honorable Chair, so that we can go into the substance of the matter, I'm going to invite the Director General, Dr. Buthelezi, and the team with your permission, to go into the presentation of the substance. Thank you.
Thank you very much, Minister, and greeting once more to the honorable members. As the Minister has given an introduction, the sets of regulations that we are amending, in addition to the notifiable medical conditions, there are 3 other sets of regulations, which one relates to environmental health, the other one relates to the management of mortal remains, and the other one relates to the points of entry, which are the ports into the country. Our presentation will be led by Advocate Mahoshi, who is the head of our legal services, and then he will deal mainly with the notifiable medical conditions, and then the other 3, which are related to environmental health, ports of entry, and human remains, will then be led by Mr. Medok Ramutuba. I will then, with the indulgence of the chair and members, invite Advocate Mahoshi to lead the presentation. Thank you very much.
Thank you, honorable members, Minister, DG, and colleagues. The presentation will deal with all 4 sets of regulations which the department is trying to come up with to deal with COVID pandemic. So I will deal mostly with the notifiable medical conditions. Janice, can go to the second slide. By way of background, it is critical to note that in terms of Section 3, subsection 1, paragraph A of the National Health Act, the minister has to make sure that within the available resources, he must endeavor to protect, promote, improve, and maintain the health of the population. So that is the mandate that the Minister of Health has. In line of that, Section 90, subsection 1, paragraph K, empower the minister after consultation with the National Health Council to make regulations. And these regulations include the regulations regarding notifiable medical conditions. On 15 December 2017, the minister promulgated the regulations relating to surveillance and control of notifiable medical conditions. However, the 2017 regulations were not geared for pandemic, but it was meant for individual cases. And mostly those cases were confined in the health establishment setting. So the national health, the notifiable medical conditions was specific for that. When COVID-19 was declared a pandemic, various legal and legislative instruments were considered to control and contain the spread of COVID-19. And the Disaster Management Act was the most viable legislative instrument, as the 2017 regulations were not geared for pandemic. So in terms of the disasters regulations, Regulation 6, which dealt with the refusal for medical examination, prophylaxis, treatment, isolation, and quarantine, and Regulation 7, dealing with isolation or quarantine of person, in terms of the disaster management regulations, were based on Regulation 15 and 16 of the 2017 regulations. So we thought it is critical to indicate that these, the disasters regulation were based on the notifiable medical conditions which were promulgated in 2017. Due to the fact that the disaster management is meant to be a temporary tool to assist the state to deal with disaster, the National Department of Health had to embark on a process of amending the health regulations in terms of the National Health Act of 2003 and the International Health Regulations Act of 1974. This is to address the COVID-19 and other notifiable medical conditions outside the national state of disaster. In light of the above, the following are the sets of regulations that are being drafted or amended. Firstly, the regulations relating to surveillance and control of notifiable medical conditions. Secondly, the regulations relating to public health measures in points of entry. And then the regulations relating to the management of human remains and regulations relating to environmental health. Just to indicate to honorable members, as we have been indicating that the surveillance regulations is not the new regulations, but however is an amendment of the regulations. And we have done a table that at least show the regulations of 2017 and the proposed draft regulations for 2022. In terms of the 2017 regulation, we had Regulation 16 that provided for mandatory medical examination, prophylaxis, treatment, isolation, and quarantine. And it is critical, maybe just to indicate that this part of the regulations, Regulation 15.1 to 6, have not been amended and therefore is still applicable. The amendments that have been done to this section have been done by way of addition. And the addition is from Regulation 15A to 15H. The Regulation 15.1 of the existing regulation provides or require for medical examination, prophylaxis, and treatment, but that has to be determined on a case-by-case basis and has to be tailored depending the public health risks and individual circumstances of the person. However, what we have done, as we have indicated, to say that the 2017 regulations were not geared to deal with the pandemic, we have then added 15A, that then deal with the refusal for medical examination, treatment, prophylaxis, isolation, and quarantine. These regulations provide that a person who is a confirmed clinical or laboratory confirmed case for a notifiable medical condition or is suspected of having contracted a notifiable medical conditions or has been in contact with a carrier may not refuse medical examination, including but not limited to the taking of bodily samples, which may be authorized by any law or be admitted in a health establishment, quarantine, or isolation site. What is critical is that there has to be authorization by law. So this should not be an arbitrary position. That is why it is clear that the regulations provide that there has to be authorization in terms of the law. And this is aimed at preventing the transmission of notifiable medical condition. And in terms of the 2017 regulation, sub-regulation 2 authorizes the head of the provincial department to apply to a high court for an appropriate court order. If a person who is a clinical or laboratory confirmed case or carrier of the notifiable medical conditions refuses to consent to medical examination, including the taking of biological specimen, or refuse to be admitted at a health establishment, or for a mandatory prophylaxis treatment, isolation, or quarantine. As we have indicated, this was meant for an individual and a case-by-case basis, and it was not meant for the pandemic. We have then introduced in the 2022 draft regulations the provisions that deal with isolation and quarantine of persons, and to provide more information as to how should isolation and quarantine be done. These regulations provide for isolation or quarantine. It also provides for both self-quarantine and self-isolation for those who meet the criteria set up in regulation 15G. And this was meant to, and with our experience, that there were people who felt that they are able to self-quarantine and to self-isolate, and therefore a criteria was necessary for self-isolation. These include that the facility must at least be separate with well-ventilated bedroom, with a bathroom and a toilet, and that they should not be shared with any persons who are not subject to quarantine. And therefore, the meals provided in the facility must be served on a room using disposable utensils that are kept separate because as a control measure. And then the facility must have a thermometer that will allow for a person to measure his temperature on a daily basis. Because this person is not monitored by health professionals, therefore it is critical that at least these measures are there, so that if there are other issues or the temperatures rise dramatically, then at least they can then make a call so that at least they can be taken care of. The criteria for self-quarantine or self-isolation was not in the 2017 regulation, as the quarantine and isolation was done at a health facility. So that's critical to also take note. If a person refuses to quarantine himself or herself, or to travel to a site of isolation or quarantine as directed, a court order must be obtained to compel such person to quarantine or isolate. And this is just to indicate that instead of having the head of a provincial department to apply to a health court, will still want to have a court order so that at least the person, if they have to be forced to go for a mandatory isolation or quarantine, at least there is a due process in terms of the court processes. Next slide. The regulations also provide for isolation of symptomatic person and asymptomatic persons. Both symptomatic and asymptomatic persons can self-isolate if they meet the criteria. However, if they do not meet the criteria for self-isolation, they may be isolated in a designated facility, and the requirement for a court order is still provided for. In this case, it is no longer through the High Court application that the HOD has to do, as we have indicated that situation was meant to deal with very separate, limited cases and not geared for pandemic. The 2017 regulation sub 4 provides that a head of provincial department must apply for High Court for an order to conduct autopsy. This regulation, as we have indicated, is still remain as it is, as it has not been amended. Next slide. Regulation 15F of the new regulations go on to provide for the designation of quarantine facilities. Above, we have been talking about the quarantine, but now there has to be a designation of quarantine facilities. And this has to happen even when it is required for the purpose of containing and preventing the spread of notifiable medical conditions. And the designated quarantine facility and isolation guidelines, so they have to meet to the criteria that has been issued by the Department of Health. And then Regulation 6, which is still applicable, the head of a provincial department is required to revise the decision to apply for a court order when the conditions of a mandatory action changes. So in other words, if there is no longer a need for a person to be quarantined or isolated, the head of the provincial department will have to go to court to change those orders, and therefore that regulation is still there. The new addition in terms of the 2022 draft regulations was the issues of contract tracing, which was made as a result of a control measure. So we have also put this is a completely new regulations in terms of that, but the purpose of that is to address and prevent and combating the spread of COVID-19 medical conditions. So that there is also a designated judge who is supposed to then safeguard the interest of those people whose information will have been put in the government database, so that there is no abuse of the information that is there. Hence the mechanism to build in the designated judge. Then Regulation 16 provide for the control of spread of notifiable medical conditions. Again, Regulation 16, 1 to 5 have not been amended and still applicable. And then the amendments that we've done to this section is again by way of addition of Regulation 16A to 16M. The Regulation 16A just provide for the general measures to contain the spread of medical conditions that can spread through droplets. These measures include the wearing of a mask when in a gathering in an indoor public space, or using any form of a public transport, or entering into a public premises, and also provide for social distancing. I'm not gonna, because maybe not deal much with the provisions on the control of spread of notifiable medical conditions in terms of the 2017 regulation, because those provisions have not been amended. We can then go on to the next slide where we have got 16B. You can go to another, yeah, 16B. 16B then provides for the control measures that will happen when a person exits the Republic. And these include the requirements for a full vaccination certificate. And in the event where such person does not have a full vaccination certificate, a negative PCR test result of not more than 72 hours will therefore be required. But it is also critical that all persons that exist in the Republic must ensure that they comply with the requirements of the country of their destination. As a measure of controlling the spread of notifiable medical condition, persons found to have contracted notifiable medical condition may be pursuant to a testing be placed under mandatory isolation. And if they are able to self-isolate, they will then have to be allowed to do so. Regulation 16C provides for the requirements for person entering the Republic, and those also include the full vaccination certificate, the negative PCR test of not more than 72 hours. However, the person who entered the Republic through the ports of entry must be subjected to screening at the port of entry and may be placed under mandatory quarantine for a period stipulated in the guidelines if they are found to have have the notifiable medical condition. Next slide. 16D then deal with the aircraft crew on international travel. And it provides for the containment measures that must be adhered to with regard to this crew member who may be empowered or allowed to disembark. And those include the screening, and if necessary, subject to medical examination, which may include testing and quarantine. Those requirements also are applicable to the crew vessel. And with regard to the local air travel, the regulations provide for screening before departure as a containment measures for all persons undertaking local travel. And those who are found to have elevated temperature or symptoms consistent with the notifiable medical conditions may be subjected to a medical examination, which may include testing and may not be allowed to board if they are found to be positive. Then 16G that deals with issues of cross-border freight operators. They may also be subjected to medical examination that include testing and quarantine if the situation warrants that. 16H then provides for the control measures when in public place. And these include public hygiene measures such as cleaning and disinfection of public places, hand sanitization, and practice of physical distancing. 16I then provides for attendance of funerals. These include the issues of limitation of attendance of funerals to 100 persons. The wearing of masks must be adhered to, and all health protocols must be adhered to. Social distance measures must be practiced, and there is also the restriction of night vigils and after funeral gatherings. 16J then deal with the gatherings and the requirements, the containment measures that must be adhered to when attending gatherings. These include the wearing of face masks, adhering to all health protocols, and maintenance of physical distancing of 1 meter. And then indoor and outdoor gatherings may be up to 50% of the venue capacity, provided that there is a production of a valid vaccine certificate with social distancing of at least 1 meter complied with, and compulsory mask wearing for indoor gatherings is a requirement. However, the attendance of a gathering without a proof of vaccination shall be limited to 1,000 indoors and 2,000 outdoors. And then Regulation 16K provides for the control visits of members of public. This is the control of members to the health establishments and facilities, except for those that might be going for treatment of medication. And they will have to be subjected to strict adherence to health protocols. 16L provides for the compliance officers. And in this regard, they are to ensure that there are strict adherence to the standards of hygiene and health protocols relating to notifiable medical conditions, and to develop a plan for containment measures to ensure that the workplace meets standards of health protocols relating to notifiable medical conditions. 16M then provides for sharing of advice. So in this regard, in order to contain the spread of notifiable medical conditions, there will have to be the sharing of advice among relevant cabinet members. To enable such relevant cabinet members to come up with regulatory measures to contain the spread of notifiable medical conditions within their own legislative framework. The health regulations will not be able to deal with everything that the disaster management regulations have been dealing with. And therefore, that is why it is so critical that there has to be the sharing of advice with the relevant cabinet members, so that they are able to take their own legislative, the regulatory measures in terms of their own legislative framework. The last presentation on the notifiable medical conditions then deal with representation, which is Regulation 17. In terms of the 2017 regulation, a person who is a clinical or laboratory confirmed cases and who refuses to voluntarily consent to a medical condition examination by a qualified healthcare provider, or to be admitted at a health establishment or for mandatory prophylaxis treatment, isolation, or quarantine in order to prevent transmission, is entitled to legal representation. So that is still there. However, the only addition or the amendment in terms of the 22 draft regulations is the amendment of Regulation 17 by adding sub-regulation 4. These regulations provide for a warrant issued by a competent court to compel those who refuse to voluntary consent to medical examination by a qualified healthcare provider, including the taking of biological specimen, to be admitted a health establishment or mandatory prophylaxis or treatment, isolation, or quarantine. The sub-regulations dealing with the legal representation have not been amended, and as such, they are still applicable. So what we have added is only that. So these are the other provisions for Regulation 17 that are still in place. They have not been amended. Next slide. So that concludes the presentation on the notifiable medical conditions, and to try and indicate the differences between the 2017 regulations and the proposed draft regulations to deal with COVID and other notified medical conditions. Thanks, honorable members, DG, Minister. Back to DG.
Thank you very much, Advocate Mahoshi. With the indulgence, just before we come into this one, on environmental health, I think subsequent to we've presented what was gazetted by the department. Subsequent to that, there's been a lot of discussions. And as the honorable members will note that when the state of disaster was lifted by the president, the Minister of COGTA then gazetted regulations in terms of Section 27(2)(m) of the Disaster Management Act, which is what we call post-disaster rehabilitation with transitional arrangements.
Sorry, DG, please switch on your camera. Thank you.
Oh, my apologies, Chair. I was saying subsequent to the gazetting of these regulations, the honorable members will note that there were then regulations that were the transitional regulations that were gazetted by the Minister of COGTA in terms of Section 27(2)(m) of the Disaster Management Act, which is what we call post-disaster rehabilitation, which then are a transitional measure to ensure that there is no lacuna in place. And in terms of those regulations, some of what we've gazetted has been revised. One of them is the funerals. There is no more, the funerals are now treated like the other gatherings, not limited to 100. So that changed with those regulations. But because we had gazetted before that, we are presenting exactly how we gazetted. And then also the issue of wearing of masks outside was dropped. So there is no need to be wearing masks outside except for indoors. And also for people exiting the Republic, there's been a relaxation in terms of the requirements. So I thought I must mention that so that the honorable members will understand that there's a difference and that there were some changes and amendments that were done post the gazetting of these regulations. I will now request Mr. Medok Ramotuba to take us through the last part of the presentation. I don't know if my minister wanted to add something. I see he's on. Thank you.
The only thing I wanted to request is that the next must be as brief as possible. We need more time for a discussion with the honorable members. So if the ones on environment and other and management of human remains, if they could please be very brief, just the highlights of what they cover, so that there's more time for discussions. Thank you very much.
Thank you, Minister, for that intervention. Yes, we really need to move faster. I counted the number of slides still left. I think they're about 18. But I see the Honorable Van Staden has raised his hand on the platform. Honorable Van Staden.
Thank you, Chairperson. I want to support the Minister in his request. I think it's already 9:45, and I think there's lots of discussions that needs to take place. I'll support the Minister in his request. Thank you, Chair.
Thank you. Please continue, DJ.
Thank you, Chair. And Medok, please move on and move quick. Thank you.
Thank you very much, Chairperson. Good day, Minister and honorable members. I will try to be brief. Where regulations that relate to environmental health, we've got one, I think the initial aspect to refer to here is that the promulgation of these regulations, Minister has powers in terms of Section 90, subsection 1, A, N, and W. And also maybe to indicate, Chairperson, that the proposed regulations that relates to environmental health are new because there was a gap that was created in 2012 when President made a proclamation that on the Health Act. During that period, all the regulations that were promulgated under the Health Act of 1977 were considered to be null, or they were nullified at the time. And we identified during daily operations by environmental health that this was a challenge. The next slide. In the next slide, if we look at it, we've got the human remains regulations that are an amendment due to, of course, the identified need and the gap that was created by that proclamation. And we realized that there was a lack of legal instruments that could be used to assist the country in managing these aspects. The three sets of regulations fall within the scope of environmental health profession, which is defined in terms of Regulation 698 under the Health Professions Act of 1974. Environmental services have been regulated under various public health acts previously, from the 1919 Public Health Act, the 1977 Health Act, as well as the current 2003 legislation as amended. Then we've got various regulations in all those acts that actually were regulating environmental health matters ever since. And They are listed there. For the sake of time, I will not go through, but basically it's on general health regulations, the offensive trades, as well as issues of sanitary regulations and management of human remains. When we look at the International Health Regulations 2005, which is the basis for the development or promulgation of the regulations that is managing port health issues, it is a WHO guide that is not yet legislated into South African law. However, in the process of coming up with these drafts that are published for public comments, there was consultation process that went through with the relevant key stakeholders and technical people that have interest in these areas. The proposed regulations on environmental health in the Government Gazette 46048, in terms of the management of human remains, which is Regulation 363, when the proclamation of 2012 came about, and then we had that gap, Minister deemed it fit to urgently promulgate a regulation in 2013 May without consultation as a matter of urgency to close the gap that was there at the time, because there were a lot of mushrooming of funeral undertakers' premises because there was no law at the time that was governing those areas. Various challenges were experienced during implementation, and both from the public as well as the industry itself. And then certain gaps were identified and some lessons were learned through which necessitated the revision of the regulations. And it was justifiable because remember when Minister proclaimed in 2013, there were no consultations, so we deemed it fit that industry and the public should be involved in that. And then the proposed amendment seeks to address the challenges that were raised by operators, amongst other things that we saw when we were dealing with the COVID-19 pandemic, were the issues of transportation of these human remains, which were not well regulated in these regulations. We've got a special section that is Chapter 5, that is putting emphasis on managing human remains during events of international or national concern like the COVID-19, which will be only effective when we've got those kind of events. And then we also brought in the issues of clarifying the issues of declaration and certification of deaths, because there were a little bit of gap in terms of managing that, as well as the clarification on the exhumation of human remains and giving the DG the powers to make directions when there are such events of international or national concern without having to go through a disaster. The regulations that talks to environmental health, on the other hand, as we have made reference to their origins from the 1977 and 1919 legislation, this regulation is meant to deal with environmental health inspections, investigations, abatement of health nuisance, and the procedure to abate health nuisance and seizure of items which are likely to cause harm or ill health to our people. This regulation brings in the National Environmental Health Norms and Standards, which the DG gazetted in 2015. But because they are not enforceable, we brought in some key elements that needs to be enforced into this regulation so that we can be able to enforce accordingly. Then the regulation also deals with environmental pollution control and sanitation systems approval, as well as the issues of management of waste in general. The next slide looks at, as we continue, it also deals with prevention of dumping, removal of waste, and noise and water pollution, which is one of the things that these and other portfolio committees before had issues with the dumping all over our townships or the outskirts of our communities. Deals with control of venom and vectors, overcrowding in premises, requirements premises during derived from existing norms and standards as well. Deals with maintenance and operation of sewage works, municipal connections, as well as related matters. And lastly, deals with the requirements for serving notices and exemptions and offenses that relates to any such non-compliances. The port health regulations that deals with public health measures in the points of entry have been developed under the International Health Regulations of 1974, which was proclaimed in compliance with the 1969 World Health Organization International Health Regulations. The regulations will be repealing the supplementary regulations that was promulgated under the 1974 Act and lastly amended in 2003, because that regulation was too specific and difficult to use in times like now when we're responding to COVID-19 or any other outbreaks, because it only focused on the 4 diseases, which is cholera, yellow fever, plague, and smallpox. So we are in a time where you need to open up so that we can deal with also other diseases. In their current state, they are no longer relevant or ideal to deal with other infectious diseases, Chairperson. The issues, again, in terms of these regulations is the globalization, which has resulted in the emergence and re-emergence of infectious diseases and given rise to other public health risks, such as Ebola, the MERS-CoV-2, Zika virus, as well as SARS, H1N1, as we have dealt them in the previous years. The International Health Regulations 2005 has placed measures for prevention, early detection, response, and broad public health risk that may arise as a result of international travel and trade. Hence, the need for us to update our regulations to align to that. Supplementary regulations have to be amended to allow for the department to have measures in place to respond to a wide range of public health risks, and also to bring into effect provisions of the International Health Regulations 2005 related to points of entry. The last slide is talking to the fact that this IHR 2005 has not been enacted as we did with the 1969 one. This one has not yet been enacted into South African law, and its measures remains unenforceable because it's just an international guide, which is has not been passed as a law in the country due to its non-domestication into South African law. These regulations are revised from 1969 version to address nature of emerging and re-emerging infectious diseases and opening up to deal with any other measures of international concern. And lastly, domestication of these IHR and promulgation of the regulations relating to public health measures in points of entry remains vital for countries that are preventive and to respond to any other measures of that nature. And in conclusion, Chairperson, it is recommended that the Portfolio Committee take note of the fact that the regulations have been published in line with Section 3 as well, 1 and A of the National Health Act, as well as 91K of the same Act. Termination of national state of disaster has created a gap that is as a result of the absence of regulations to manage future pandemics and other communicable diseases, which these amendments that we are working on are closing that gap perfectly well. Department has embarked on the process of amending these health regulations in terms of the Act and the Health Act, as well as the International Health Regulations, in order to address COVID-19 outside the national state of disaster. And lastly, public participatory process is currently underway to receive comments on the published regulations. We've got over 150,000 comments that we have received ever since Minister published these regulations for comments. And thank you very much, Chairperson, for the opportunity.
Thank you very much, Medoc. Just to add then, before I give back to my minister, the minister has authorized us to extend the period for extra 7 days, and that will be in the Gazette this morning. And we've now, in addition to the email, people can actually use the WhatsApp number that will be gazetted this morning to actually comment on the matter. Thank you very much, Chair. I'll hand over to my minister. Thank you.
Yeah, Chair, just 1 minute, just to say that, just to add on what the DG said earlier on, that over time, as we have also been discussing the post-disaster transition, as he has mentioned, these have been tailored down to very few public health measures. what we are also considering as we receive the comments, just to indicate that even last night we had interaction with the South African Council of Churches led in a meeting which was chaired by the president. So they also, just to give you an indication of various stakeholders who are making inputs. As even before we come to the conclusion, as DG indicated, we are extending to the 24th of April to allow also on WhatsApp further comments. We are also considering, as advice keeps coming, that we may need to separate the broader public health measures of surveillance of notifiable medical conditions from the specific measures which are now, for instance, implemented under the post-disaster recovery, so that we remain with a very small focus on the post-COVID, the COVID post-disaster management, away from, separate that from the broader intervention on notifiable medical conditions broadly. So those are the considerations, and we await comments from the honorable members. Thank you.
Thank you, Minister, the DG and your team. I see there's a question from Honorable Dr. Susan Thembekwayo. We have the WhatsApp number. But thank you very much also for the extension which you deem necessary to have. It's been raised by quite a number of people and by the members that we needed to have other forms of people being able to give their input on these regulations. So that is great. And, you know, looking widely at what was presented here today, I can see that you've applied your mind very broadly at what was still outstanding in terms of the National Health Act. And of course, we've now learned that we need to have certain regulations in place, as we've just experienced with COVID, and the importance thereof. So from my side, I want to thank you for having brought these regulations and having actually put these together and having allowed the public to give comment on those regulations. I'm not going to take a lot of time. I just want to move quickly to give the names of the members who want to raise some questions with you. Honorable members, I might just lose my connection for a little while because we will be having load shedding in the area where I am. But I'm going to mention very quickly: Van Staden, Clark, Thembekwayo, Slengwa, Ismail, Gela, Zuela, Harvard, Soekers, Munyai, Wilson, Chirwa. Van Staden, Clark, Thembekwayo, Slengwa, Ismail, Gela, Zuela, Harvard, Soekers, Munyai, Wilson.
Communicated until 5 o'clock tomorrow morning, when we will lift it for the long weekend, if everything goes according to plan. With that, Sikonati, I'm going to ask you to moderate any questions that there might be at this stage. Thank you.
Thank you for that update, Andre. Colleagues, you already have received the media statement, which confirms what Andre has said. And I humbly request you to use this conversation, what you are recording here, for your voice notes at the broadcast media. I do not have any questions at this point. Okay, there we go. Terence has just gotten going. What is the position regarding units at risk? That is the question. Philip, are you able to answer that, please, or Andre?
Let me answer it. So, Terence, today the units at risk, it's just under 10,000 megawatts. We've got 9,780 megawatts units at risk, and that ranges from partial load losses to full load losses. And it's anything boiler tube leaks, units that we know are running with boiler tube leaks or high vibrations, so certain areas of plant that we under stress that may give at any stage. We will be using this weekend, and we have in fact started to do so, to try and reduce the amount of units at risk. Unfortunately, some of them 5 days, 7 days. So that is why we are also worried about next week, particularly the start of next week, although it's a long weekend. But
I also want to urge you to work with speed, because we are now at the middle of April. Next month, we'll be entering our winter period. We've now seen the floods in KZN, for example, of the challenges there. And these things can happen at any point in time. So I'm hoping that you will be able to make these regulations. It's not enacted, but it's gazetted. To gazette these regulations and to make certain that we are protected as a people and as a nation from any possible future similar infections, notifiable diseases, but also this one in particular, as I had stated, we are just going to be entering the winter period and we do not know what is lying ahead for us. So, Honourable Minister, those are all the points raised by the members of the Portfolio Committee. Quite a number. There are 14 of us who have raised concerns with you. We are now at 16 minutes past 11. We thought we would take 2 hours. We're going to take an extra hour, meaning we will try to finish by 12 o'clock today. So if you can do your utmost best to answer all of these concerns of all of the members. Thank you.
Thank you very much, Honorable Chair. I do have a bit of pressure that I've got another commitment. So I would appreciate if we could be done before 12, because I do have another commitment at 12 o'clock, so I would need to just be ready before 12. But thank you very much for the opportunity, and thanks for the honorable members. I'll try and put together a number of points which have been raised so that we don't go point by point, but combine some of the points. Firstly, let me just correct the honorable members who said that we have been forced to come to the Portfolio Committee. I mean, nothing can be so far from the truth. We were requested by the committee to come and share this matter, and we immediately agreed. Now, honorable members, what we are doing here, as we said earlier on, it's exactly in terms of the legal procedure that you have an Act of Parliament passed in 2003, the National Health Act, and the advocate, the legal person from the department did go through the procedure. With in terms of that act, the act empowers the minister to pass regulations. The regulations which we are amending were passed in 2017 by the minister who was in office at the time. And what we are doing is to amend. Now, even when those regulations were passed, as the report indicated, because the Act itself also makes provision for the minister to can actually make regulations and promulgate and gazette them without public consultation if the minister is of the view that there is agency in terms of promulgating those regulations. That's within the law. That's what the law which has been passed by Parliament enables the Minister of Health, and you will find similar provisions within various other legal frameworks of other portfolios. And that's really to make sure that the executive of government can function and can provide particular regulations without the necessity, once the framework is passed by the Parliament, by the National Assembly and the Council, National Council of Provinces. Once that framework of the law is passed, the ministers of those portfolios, if it's catered for in their legal framework to promulgate regulations, either some of those regulations provide for public consultations, and in certain circumstances that they can be implemented immediately, as it is the case, for instance, with the Disaster Management Act, but also in terms of the National Health Act, in terms of provision where the matter is looked upon as urgent. So that let's just lay that that matter to to rest. That any notion, therefore, that we avoided once we got an indication from the chair of the committee that there are certain requests. We have to. The only thing which we had to agree on was in terms of the logistics, the time, and so on, the day and time when this could be done. So I want to just lay that to rest, that any notion that we came here first must really just be laid to rest, because it's actually unfounded. In terms of just a few other matters which I'll go through from the contribution of members, the fact that COVID is not listed in the list. Now, honorable members, the list as provided in the regulations will not be exhaustive. It will have categories. There are certain which you will find in, because they already registered, they exist. But the infectious diseases change. COVID-19 as it is did not exist when the regulations were first, promulgated. But there's a category in terms of pathogens which cause respiratory diseases. I'll ask the advocate just to later on just to read the exact clause which talks to this. So there's going to be other, not even a variant of COVID. There will be other viruses which will come. We don't know when. It's going to depend whether they are in terms of what category of infectious disease. You may not have in the list the specific virus which causes that particular disease, but it will be looked upon and managed in terms of notifiable conditions, in terms of the category in which, that it may be, if it's a hemorrhagic fever, it will be dealt with in terms of communicable, notifiable medical conditions in terms of in terms of hemorrhagic fevers. So it may not be, there may be a new virus which causes hemorrhagic fever, but you can't say because that particular virus in itself, it will then be added once it is, that particular strain is actually, so that is not a factor in terms of what we're dealing with. The category is there, and that's how COVID has been dealt with as a notifiable medical condition. The emails issue we'll look at. I'm quite convinced that it is a technical matter which we'll sort out. And as we have said, we have provided now also a WhatsApp which creates even further opportunities. In terms of the view of some of the members that we must totally withdraw the regulations. Again, I draw your attention to the fact that this is within the law which has been passed by Parliament, within the regulations as provided for, which are purely being amended, which have been in place, promulgated almost 4.5 to 5 years ago, as already indicated. So, and let me just also, again, I know that there are other members who actually went as far as saying that this, in terms of these regulations, the Minister of Health is now assuming powers to can cause lockdown, to can really lock down people, force them to be tested and so on. Again, honorable members, just to say to you and to the public, there's no such a thing. There's no such a thing. If you listen carefully, first of all, just in terms of, there's very limited, powers in terms of these regulations. And what is being fundamentally, if you look at anything, there's actually nothing different from the kind of basic remaining protections. If you look at where we come from over the last 2 years, all that this largely these regulations want to protect in terms of public health measures is the basic minimum in terms of making sure that protection, and I know some of you also question the question of wearing of masks. This after a bit of uncertainty earlier on in 2020, the World Health Organization and scientists throughout the world did a lot of work in terms of confirming that because as a droplet infection, as an infection which spreads by droplets, when you cough, when you excrete from the mouth and so on, once those are trapped through the mask, that limits the spread. And we have seen very clear, benefits of that when we look at, just look at, when many more people used the mask in the year 2020. We didn't even have any flu infection during the course of the year. And over the last 2 years, because of the use of masks, much more in 2020, but even in 2021, a little bit more, not only in terms of COVID, even in terms of the spread of other respiratory diseases. Very much, just the one which comes every year, which is influenza. Very little of that actually happened. So if the people who still question whether masks work, I don't know what more evidence do honorable members still require. In terms of the fact that the allegation that the regulations infringes on the rights of people, again, I think that is very far from the truth. In terms of the control measures, the public health measures of where we started in 2020, the only basic ones remaining now, it's basically in terms of the protection of indoors, making sure that masks are worn indoors and no more outdoors because of the level of spread of the COVID currently and other protection measures. But across the board, there's still a few. I mean, scientists are like all of us as members of parliament, politicians and so on, will never agree on everything, whether you talk about any profession for that matter, whether you go to lawyers, whether you go to accountants and architects or whatever, engineers. The medical science profession is also the same. But you look at the bulk of where the majority of views and observations on particular measures. Now, the use of masks, as I've said, is one of those, especially indoors, which across not only in South Africa, if you can, if you look at the advice also from the World Health Organization, that is very firm. The issue of the fact that respiratory infections such as COVID, and we have seen it. I mean, it's not even just a basic science, but we have seen it that one of the major triggers of, spikes of infection, it's a crowded gatherings, especially indoor crowded gatherings. So one of the second remaining area in which these regulations want to assist in protecting the public as empowered by the Act is in terms of gatherings. That's why it's the limit on the size of gatherings without vaccination, because vaccination does help to protect. And when we have to have bigger gatherings, that those must be accompanied by vaccination or a negative PCR test. And if those gatherings are indoors, they must also be accompanied by wearing of masks. So in terms of infringement on social liberties, really, there's very limited in terms of anything, whether we talk about social gatherings for whatever use, whether it's in arts and culture, in sport, family gatherings, other forms of social, all those, are happening. So in terms of this infringement on people's rights, I don't know what exactly the honorable members who are raising this are talking about. And again, I've already mentioned that the issue of that this empowers the Minister of Health who can enforce the lockdown. There's nothing like that. There's just absolutely nothing. It's very limited in terms of basic public health measures. Forced medical treatment, we've already mentioned that this is in specific situations where somebody who has not just because this regulations, while being prompted, the amendment, while being prompted by the fact that we still have COVID as a threat. And just coming to that, Honorable Sheikh Imam, I'm really disappointed to hear from you that as far as you are concerned, the COVID is the thing of the past. That's really what is causing problems, where people believe that the COVID is done and over. That is far from the truth. We can see. I've already indicated from the science. You can talk to. I mean, if you we can make available an analysis from Professor Abdul Karim, who was the first chair of the Ministerial Advisory Committee, just analyzing the trend of the COVID over the last 2 years, the trends in terms of the ups and downs, the waves, where we are now, that it is a trough. In terms of the trend of what we have seen over the last 2 years, that every 3 months, the same trend has happened. It's only if in the next 2 to 3 months that we don't have a spike again, as we have seen, not only in South Africa, but in other countries as well. So the notion that COVID is gone and done with, we are not there. We're all hoping that it's going to happen. But that notion is quite misplaced. With due respect, I must say to you, if that is what informs your rejection of the interventions, which are very basic minimum, actually. So the issue of there is no such a thing. The provisions which are made there, as you heard from the advocate from the department, these are also buttressed by legal support in terms of the fact that in a case where somebody who has proven to be infected with any of the notifiable medical conditions, which can be passed on to other people in terms of how it is spread, and that person refusing to take the necessary medical intervention, there must be an approach to the courts. There must be the only way in which certain interventions can be forced. It's with the support of a court order. And it looks as if some of the honorable members have actually disregarded the fact that in the regulations themselves, which are derived from the 2017 regulations, and as we are now amending, but that requirement for a court order, the only thing which is now different in the current regulations, instead of just the High Court, what we are proposing is that even lower courts, like magistrates, could be able to be approached if in a local area where there's such an event. The health authorities should be able to approach even a lower court to can obtain such a court order. But that is what is being provided for. So the issue that there will be forced vaccination, forced treatment, is really, I don't know if honorable members can go and just look into properly. You will find that there is no such a provision in terms of this. The question of whether this is based on science, of course it is, as I've already indicated. The science behind this one is that COVID is not over, that there is expectation that there will be another wave of COVID. We don't know exactly when. The factors which influence that we know is the variants, but also as more people gather, especially indoors. And that's why, as Honorable Jacobs has indicated, the countries which have gone through their winter have experienced spikes. And that's why in countries like China, currently as we speak, a big city like Shanghai, which has got more than 20 million inhabitants, is currently under lockdown. And that's because, and various other countries have got to reinstate some of the control measures, as one, the question of variants, which currently we are getting weekly reports, sometime on a daily basis, in terms of updating of the various variants which are still doing rounds. Fortunately, up to now, this has been only variants which have been of interest as the WHO classifies them, but not variants of concern. They have not been accompanied by a spread of exponential spread in South Africa. But it has happened. It's happening in other countries. Those variants, what is driving the rise in infections in some of the countries is also variants. And the fact that they'd also gone very quite lower down in terms of control measures. So that is the science. It's the science which we listen to. But as I've mentioned, even our South African scientists have never at all times been at one. There are particular areas which we understand some of the scientists why they criticize. It's because the measures, the regulations which have been published encompass broader, controls in terms of surveillance of for control of notifiable conditions, not only in terms of where we are, because it's an amendment of the existing regulations. Some of those, for instance, let me go straight to issues of quarantine, issues of isolation. We have already issued directives which says that we are not at the current moment in terms of COVID where we are. We are not continuing with contact tracing, with a compulsory quarantine and with facilities specific for that. But because the regulations are providing not just for now, and that's why I said even on the onset, that what we are considering as we go towards completion of this process, we're also based on this kind of advices, looking at separating between the amendments which are just upgrading from the broader control of notifiable medical conditions as distinct from the measures which we still need specifically for the COVID as one of the existing pandemics which we specifically have to deal with. So we're looking at that. Some of the scientists we know we have spoken to, and we've spoken to them, and their concern has been the fact that the regulations bring as if we're going back to the measures on COVID in terms of contact tracing, quarantine, isolation, as we did in 2020 and early 2021. So that's why we're looking at possibility of separating what will be just standard measures when there is a new notifiable condition, especially a respiratory one, which spread in a particular manner. But as compared to where we are in terms of the control of COVID and the measures which we are no more utilizing. So we're looking at that. And some of the scientists which some of the honorable members quoted, their concern was specifically on the question of reinstating issues of quarantine and isolation and contact tracing, which we have already passed in terms of those. The issue of, I think I've dealt with the allegation of infringement on religious rights. There is no such an infringement. The issue, where we talk about gatherings, is gatherings across the board. There is no specific, measure which is aimed at religious gatherings. And religious gatherings also benefit from the provisions which are there in terms of where without the vaccination check, you can have up to 1,000 people gathered with a 1 meter distance as a maximum indoors and 2,000 outdoors. That also caters for religious gatherings. So there is no specific infringement on religious freedom. The significance of the regulations is simply to make sure that we can be able to continue to be protected. And I want to agree with, I think it was Honorable Sukers who said that South Africans have made a lot of sacrifices over time. We agree with that. But what we want to say is that in recognition of that, we are saying that it will be irresponsible as government to then lead the country into an approach which does not protect the sacrifices which many people have made. All that we want to make possible is to guide the country in a manner such that the sacrifices which have been made are not brought to zero. That all those the things which we have done, which have brought us where we are, where we're able to manage the pandemic, that we should continue, even as we're looking forward to all the warnings that as we go into winter, as we get more and more gatherings indoors rather than outdoors, and as the possibility, as various variants are coming through, that a rise in infections and the fifth wave is likely to happen. We should not be at a stage where we have dropped everything and now nothing. I mean, people are just so vulnerable that even the basic measures, which are the very few, 3 only, which is the mask, which is the control in terms of how we gather, especially indoors, and also in terms of our ports of entry. On the ports of entry, maybe quickly, let me just say that in terms of the approach now, it's to leave the issue of those who are leaving the country, leave it to the measures required by the country of destination. There are still many countries where the idea was to make sure that just to guide South Africans, because many countries still require a vaccination certificate, and some also require, in addition, a PCR test. But our approach going forward is that should be the South Africans who are traveling should study what is required by the airlines, if it's an airline or whatever mode of transport, but also especially the country of destination. So the significance of these regulations is really to make sure that we can be protected, that we don't lose the investment which we have made in terms of the protection, which has done us well up to where we are today. The role of the Border Management Authority versus Port Health in terms of the new approach of the Border Management Authority, the actual function at the borders will be under the Border Management Authority, but the regulations, the policy will still come from Department of Health, but the actual operation, Port Health will operate also under the auspices of the Border Management Authority. The training of funeral undertakers, I think a number of honorable members raised that. Indeed, we will be, I think from our environmental health side, that process will continue of sharing information and availing information and training. In terms of whether we've also considered rural areas, indeed, and in terms of the consultation process, that's why we also thank honorable members who pointed out that emails may not be accessible to everybody, but we know that even in rural areas, WhatsApp, is many people even in rural areas have access to WhatsApp. Consultation also in the process. I'm sure that in some of the submissions, also people in the rural areas and also traditional authorities will be commenting. The current infections, currently, as I've mentioned earlier on, that we are on the trough in terms of the lower ebb of the curve, where the infection numbers are sort of, on day to day, on week to day, they are fluctuating, but generally much lower than where we were in November and in December, end of November, end of December, and even early January. The significant note at this stage is that, nevertheless, we have not gone to the lowest level of where we were at the end of October 2021. So because of the fact that the mutations are happening, as we are informed by the scientists, we have not gone to the very lowest level, as you would see that even in terms of the positivity rate in October last year, we even reached the lowest level of 1%. And with the current, even though it's at the low level, we have not even reached that 1%. So the numbers fluctuate. Some days, like I think yesterday, we were just around 2,000. Some on weekends, usually we go below 1,000 infections. But we're still in the area where we're watching every day because there are always these indications that there are spikes here and there, which we have to make sure that we can follow. Chairperson, I know that we don't have much time. I'm just trying to see the time to consider the submissions. Yes, this is happening as the submissions are coming in. I can assure honorable members and members of the public that we take this very seriously. We are looking. We're not waiting for the end. As I said, now from the 16th we have extended to 24. But the analysis is happening on a continuous basis. We have a team, within the department which brings in also other specialists who are able to help us in the analysis. But at the end of the day, this is a process which within the law, within the National Health Act, it's now in the hands of the Ministry and Department of Health. But what we want to assure everybody is that we take all the submissions seriously, and that's why we are concerned about where it said that emails have been deleted, and we're going to make a very serious follow-up. Whether we differentiate based on variants, no. Even in terms of notifiable medical conditions, no. As I've said, its categories. It's hemorrhagic fever conditions, pathogens which cause respiratory diseases in terms of, SARS-CoV is one of those which is classified as one of the pathogens which cause respiratory disease. It may not be necessarily said COVID-19, but also in terms of COVID-19, we don't then classify in terms of every variant, because the variants, the basic way in which the disease, the pathogenesis of, or the pathophysiology, how the pathogen causes the disease and how the disease manifests is not very different. It's just a question of the transmissibility and sometimes the severity of the illness, but the actual physiology of the disease remains the same. So that's why we treat it as one, as COVID-19, irrespective of the variants. Of course, the question, I think I've already dealt with the issue which honorable members believe that we are forced. We have not been forced to come to this meeting. It's part of when we are asked to come. The law empowers us to make regulations, but once we get an indication that the committee would like to engage, we are there, we are available to come and engage. I've already dealt with, honorable member wanted to know why regulations when infections are going down. I've already indicated that there's a pattern of over the last 2 years. We have seen up to this fourth wave that this is the pattern, and therefore we can't relax simply because, as it has happened in other waves, we have been here before, where there's very low infections. The only difference is that some of those, when it happens, people had not been vaccinated. So that's the difference. But our vaccination rate is not as high as other countries, which are at 90%. So we have to be concerned, and that's why we still need further protection. I've dealt with already the issue of isolation and quarantine, that it's in terms of future, in terms of the current where we are with COVID-19, we are not going to use the quarantine and isolation and contact tracing. That's a matter behind us. But because the regulations look at the future, other pandemics and other notifiable conditions, that's why we're looking at separating what is required just for COVID now and what we still require for future pandemics and notifiable medical conditions. Clearly, Honorable Sheikh Imam, again to say the notion that this is draconian, I don't know what really constitutes draconian. In terms of wearing of masks, in terms of making sure that people don't gather in big crowds without social distancing, and also making sure that when that happens, it must be with particular protection, including vaccination, and also making sure that when people come into the country, they must also be protected in terms of vaccination. I don't know. If you regard this as draconian, then I don't know really to you what would be any public health measure. And that would be interesting for me to know, for us to know what would constitute public health protection to you if simple measures such as this are looked to you, appear to you as being draconian. Honorable Chair, I think I've tried, and I will just ask Advocate Makoshit just to deal with the issue of that COVID is not in the list, because there are a number of honorable members who continued that. If we can just allow him just specifically on that, but otherwise, with the time available, I think, thank you very much, if we could allow him.
Thank you, Honorable Minister. Yes, I will allow him. Advocate.
Thank you, Chair. Thank you, Minister. In terms of the 2017 regulations, Annex 1, Table 1, Item 18, provides for respiratory disease caused by a novel respiratory pathogen. And it includes example of novel respiratory pathogens include a novel influenza A virus or a MERS coronavirus. And this is the basis on which COVID-19 was dealt with within that framework. This Annex A has not been amended and is still part of the existing regulations. Thanks a lot, Honorable Chair and Honorable Minister.
Thank you very much, Honorable Minister. There is a hand that has been raised. Honorable Soekers, I give you 30 seconds.
Chair, in light of what the minister said, the minister is basically saying that the portfolio committee's understanding of the regulations and the impact of it, or not the impact rather, but the, I'm sorry, there's a misunderstanding between how we see the regulations and it seems most of the public. In social development, we've had, and at basic education, a round table, and I want to suggest, because for us at least, the wider implications of the regulations, that there be a round table with the minister. What the minister said now around the scientists, I can send the minister the article. The very scientist is not about the broader implications alone. If I take just the mask, I will say to the minister, the same scientists are saying it provides little to no protection against being infected. The question that we need now is this: will these regulations be implemented in place after the 30 days? And whether COVID is as a notifiable medical condition, these regulations are going to be now implemented. That's what we need to know as a matter of urgency. Thank you.
Honorable Van Staden's hand was up, and Honorable Clark, you only have really 30 seconds, please, both of you. Thank you.
Thank you, Chairperson. I want to concur with Member Soekers that we have had the discussion with roundtables. I think since the starting of the pandemic in 2020, we as a committee, it feels like most time feels like we are keeping in the dark on certain matters, and I think it's important to have such roundtable discussions with each other before we have a situation again which can get out of hand. And just a note on what the minister was saying, we didn't say, I couldn't remember anyone saying he was forced to come here. I thanked him at the beginning of this meeting for coming here because we requested him to come here. Just want to clarify that. Thank you, Chairperson.
Thank you. Honorable Clark.
Thank you, Chairperson. I concur with the previous members. I think this needs a lot more discussion. And I would like to highlight that in the current form of the proposed regulations, the DA completely objects the proposed regulations to the Health Act in its current form. Thank you.
Thank you. I'm going to take that last, and honorable members, do not raise your hands after this. I'm going to take Honorable Munyai. Then I'm going to get a last response from the minister, and we are then going to adjourn this meeting. Honorable Munyai. Honorable Munyai. All right, we've lost Honorable Munyai. Honorable Minister, you want to respond to those very quickly, and after that, honorable members, I would still like to...
Honorable Chair, all I'm saying that through you, Honorable Chair, all I'm trying to put forward is that we can't have endless discussions because the platform has been provided for anyone to make an input. I think Minister answered all our questions. So therefore, Chairperson, I propose that we go forward, having been clarified today by the Minister. Thank you.
Honorable Minister.
Mr. President, I'm supporting Honorable Munyai, fully supporting Honorable Munyai.
Point of order, Chair. Point of order. This meeting is now, it's not the correct way, please.
Okay, honorable members, no more hands, no more discussion. Thank you very much. We're coming towards the end. I'm now allowing Honorable Minister to respond to just those 1-2 short points. I've already made my ruling. No one else to speak. Honorable Minister.
Well, thank you very much, Honorable Chair. Just to assure the members that we will indeed consider the views which they have expressed. What we don't agree with is just an outright rejection without actually making an alternative. We believe that as a government, we have a responsibility to guide the public in the midst of a pandemic which is still there. The pandemic is not over until the WHO declares that this pandemic is over. So we will consider the submissions. We are busy even now, and we remain available in terms of, as we have done over the last 2 years, whether in terms of the pandemic or any other matter. if anytime if there's a request from the portfolio committee for further engagement, nevertheless, we'll carry on, do our work as mandated by the people of the Republic, and also in terms of the laws which govern how we must function. So, but we're available even beyond this for any further discussions on any other matter, not just COVID-19. Thank you very much.
Thank you very much, Honorable, for coming today to brief us. Indeed, it was a wonderful briefing and robust discussions and very well answered. I think it gives a lot of clarity to the members of the Portfolio Committee, but also not only to the members of the Portfolio Committee. We take cognizance of the fact that this has been live broadcast on our national television. So I think it has been a wonderful opportunity for people of South Africa to deal first-handly with these regulations, the process, and where the minister and the department think they will be taking it in the future. We also want to just recognize, and we should have done this in the beginning, the family of those whose lives were lost with the floods in KZN, and also so much property damaged, and the visit of the President and ministers to the province of KZN. We also note that the number has been put on the chat for the WhatsApp groups. I'm going to mention it here so that the public can also then note this number down for comments on the regulations, on the notifiable relating to the surveillance and the control of notifiable medical conditions. It is 06 00 123 456. 06 00 123 456. Then, honorable members, we will resume normal activity on the 19th of April, where we will be receiving presentations from the entities. There are two very important dates, the 4th of May and the 10th of May. And the 4th of May, we will be adopting the committee's report. And on the 10th of May, it will be taken to the National Assembly. So we have a lot of work to do towards those two dates.
Sorry,
and
Chair.
then finally,
Sorry, Chair,
while
you're on that subject, please, we need to, I don't know how to put this. We've got the Z list, okay? And our committee does not even feature on the Z list. Now, we plan our lives accordingly. Our lives are not just portfolio. There's lots of other parliamentary work that we do, and lots of work as members of the Portfolio of Health. Our committee is not even on the Z list. It's not even on the Z list. It makes it very, very difficult for us to plan ahead when, you know, we're expecting one day of hearings and we suddenly find out there's 3 full days that haven't been planned for because we don't even appear on the Z list. Can we please get that attended to?
Thank you, Honorable Wilson. Ms. Majalamba, you are noting that to make certain that we do appear on the Z list. But just for you, honorable members, this program, there's a stringent process to go through for these programs to be agreed to by the programming committee. And we normally are way ahead with ours. Just to put you at ease that you're one of the committees who do very well on our program. And then finally, honorable members, all of you, have a wonderful Easter weekend. Stay safe, drive safely wherever you're going, and come back safely again. And to your family members, do enjoy the rest. Thank you very much. This meeting is adjourned.
Happy Easter, Chairperson.
Thank you, Chair.
Happy Easter to all of you.
Thank you. Goodbye.
Thank you, Chair, to you too.
You.
Recording stopped.
Can the host please close the meeting?
Thank you, Honourable Chairperson, for this opportunity and for opening the proceedings. My name is Jacques Duprier, and I'm representing the F.W. de Klerk Foundation in these proceedings today. And before I start with the more formal presentation and our submission in this regard, allow me to express my gratitude on behalf of the F.W. de Klerk Foundation for this opportunity to address you, Chairperson, and also the other honourable members of this committee. Thank you to Ms. Majalamba for logistical and technical assistance to allow us to do so. And from the foundation side, we most sincerely hope that our submission is positively received, and most certainly us engaging with the committee on this most important aspect for all South Africans, that we find each other on favourable terms, and that our submissions be viewed not in a way as critique or in a non-positive way, but indeed in an engaging, positive and constructive way. Because like the members, I think like everyone here, and like you, Chairperson, like the other honourable members at the Foundation, we share the concern on this most important topic of national health insurance, and also the provision of health services and healthcare to all South Africans, and then also the idea and the concept of universal health coverage. So again, just to cap off my introduction, thank you for this opportunity. We are grateful for it, and we hope to constructively engage with everyone in this regard. The F.W. de Klerk Foundation, Honourable Chair, is a not-for-profit organisation, and we work to promote and safeguard South Africa's Constitution and its Bill of Rights. And then we also work as a team and as a non-profit with this overarching goal towards promoting positive relations and community building efforts in South Africa and in its various communities. Chairperson, allow me to just share my screen, honourable members. I'm just going to share my screen with you to indicate and to bring our submission in that regard to the fore, so that as I proceed with our submissions, that I can indicate and take you with me through various aspects that we feel would be important to bring into your attention. I think I would like to start off right at the beginning, perhaps by way of lighter introduction, by